Hi, everyone. Good morning, Sunday fireside chat. I do have a little fire going on here. And let's see, what is it? I didn't even, it's the 11th of July. La Bellezza del, let's see, Melanated. Hello, IVF warriors. We need to be IVF warriors. That's for sure. All of us. It's fertility warriors, whether you're doing IUI, IVF, or just having sex. Just keep at it. Don't stay. Hey, melanated. Let's see. Mish, hello. Mimi Poppins, hello. Edu. Beautiful day. God bless to everyone. I feel so blessed to be alive, sharing thoughts and ideas to improve your health and wellness and your fertility. I'm working on my next Dr. Kiltz's keto lifestyle for fertility. I'm really working on that right now. Excited about it. Don't forget the family building guide and our supplements we're working on, and really excited about all of these things. Let's see. Tamina, hello. How are you doing? The convo today is about improving your fertility. Oh, and love. Lots of love always. We have to just hold love for ourselves, our family, our friends, our neighbors, and everyone else. And even this crazy journey of fertility, we have to have love for it, because anything we hate hates us back, and the hate only hurts us internally. Hello, Michelle and Elizabeth. How are you guys doing today? Let's see. Be Noble Jack. Hi, how are you doing? Anna Bean, hello. Lindsay, Lavender, Sarah, hi there. I'm only shortening some of these because sometimes it just, my drawn out takes a little bit longer. T Sweet 05, good morning. It's a beautiful day. We have a very, very busy day coming up. Let me just silence this thing so maybe I won't get interrupted. I do take text messages and calls from time to time, and I'm really trying to keep it so my Sunday is my Sunday day of rest. And we're going to talk about endometriosis, inflammation, keto, of course, supplements, the molecular fertility supplements for men and women, because you got to make the sperm better and the egg better. And remember, if the sperm looks good and the eggs look good, or at least you have no tests that are positive, it's an unknown cause. It can still be the sperm. It could still be the egg. It could still be the embryo. And it's always the Ferrari. Remember, we are Ferraris. We're the human Ferraris. That's it. Giselle, how are you? Razan, recommend using NAC and NAC with zinc, K2 with vitamin D. All of those supplements are really good. Remember, the majority of these things are locked inside animal fat. And so by eating carnivore keto, and look at, let me see where the book is. Do I even have it? Oh, yes. Judy Cho's book on carnivore cure. But again, I had a really great talk with Brianna yesterday on vegan and keto, and it really is up the fat, hemp seed oil, coconut oil, cook the carbs well, and eat one time a day. And remember, fat contains twice the calories of a carb or protein, and you got to use them. Inositol, mina-inositol, or ovasitol through Theralogics. Metformin low dose, 500 milligrams. That's the max I like to use. Dr. Corley likes to use a little higher doses. Remember, all of us are suffering because of the standard Western American global diets are high carbs, 3 to 6 meals a day, 10 meals sometimes, which is basically a metabolic disorder. And that's what we're suffering from, a metabolic disorder. It's pre-diabetes, diabetes, post-diabetes, and it's glycation. So the inositol, myo-inositol can help with that. But really the most important thing is one meal a day. Oh man, one meal at night is my dictum. One meal at night. And yes, from time to time, you can have a little bit of cake, ice cream, or cookie, but from time to time, not all the time. And Kiltz's ice cream, like also time to time. Modified natural transfer after 2 failed. Which medications? Well, letrozole trigger with or without a little bit of steroids, a little bit, don't forget low-dose naltrexone, keto, and an antibiotic potentially. But really, if you're thinking, well, I don't have anything wrong with me, I just want to do a modified natural, then go for it. Letrozole or natural with the trigger shot. You can still, don't forget to think about laparoscopy, hysteroscopy for endometriosis, or the medical treatment for endo for at least 2 months, which is either Orlissa or Lupron plus letrozole. I think that's really helpful too. Let's see. Judith Glant. How you doing, Judith? Empty follicle is truly empty, or is it could be bad timing between HCG and egg retrieval? 32 to 38 hours after a trigger shot is our window. Typically, we're doing about 34 to 36 hours. It's possible that that window for you, which is not common to be outside of that, but it's possible. It's more likely that either there was no egg inside that follicle, or it degenerated, or it just didn't come out. And these are one of the factors that come to us in this fertility IVF world, that you may take your trigger, you may have your ovulation LH surge, but you may not release an egg. That's the mystery of this whole business, unfortunately. Current has me 2,500. Can't wait to go to you guys. Try a lower dose, but most of all, let's see, Britton Scott. I don't like the metformin at all. I like to really work towards Kiltz's keto, 1 meal a day. Cook the carbs well if you're going to eat them. Minimize the carbs, and no raw vegetables, fruit, fiber, seeds, and nuts, and almond milk. Oat milk, I think, are deadly and dangerous for us. You shouldn't grind up seeds and consume them like that. They're not good for us. Sarah Plymouth, happy Sunday. Albany, Dr. Ditkoff, Dr. Grossman, and we're really excited about them doing an awesome job. Natalie Freeman, did you ever do IVF before? Hey, and you guys are asking questions and answering questions within this forum. Really great. Thank you very much for doing all of that. We're a global team, by the way. We're all working together. I'm going down to Sarasota the end of this week, going to be working on a new office down there. I'm still going to be taking some calls through the week in the morning, but really want to get us going on our Sarasota digs for sure. Let's see. All right. You guys are awesome and amazing, by the way. James Barcy, let's see. Red meat is bad for fertility. That's a fantasy that's not true, by the way. Red meat is not harmful at all, in my opinion. And the more I've done this personally, I've seen so many people doing it. Red meat is healthy for us as human beings. That's the diet that we became human from. A high plant-based, low-fat, 3 to 6 meals a day is deadly, by the way. The organ transplant meds prescribed, can't remember the name. What are they hopeful? Let's see. Let's see. Tacrolimus or Prograf. We use a lot of Plaquenil, Neupogen, lipids, Lovenox. And if you go to the family building guide, wherever I have it here, you can go to the immune protocols 1, 2, 3, and 4. Get a lot of really great stuff in here, but you either get this on Amazon, or I think you could download it from our website. It's all in here somewhere. My huge list of options, by the way. And it's just a list of things that you could look at if you haven't done before. And then it's look at our different immune protocols and our supplement ideas, and all these things are in the family building guide. Amazon, you can get a paper copy or download the digital copy for an idea. Doing monitoring at Philadelphia. Awesome. We're really working with Dr. Ivanov to get our Philadelphia office. I've been talking to him regarding linking with the Ukraine for surrogacy and even more donor eggs potentially at a lower price. Might be something that many people are looking at if they need a surrogate gestational carrier, because it's so expensive in the U.S. But if you bring a family member, a friend, a neighbor, we can do that also. Prograph, that's the one. We are LGBTQ, and we here at CNY Fertility are here to take care of all people. We honor everyone, no matter your sex or gender description, size, shape, age, weight, color description. Doesn't matter. CNY Fertility is here to help you in all ways possible. We are working on intralipids at the Philadelphia office. We're going to add to our team there. Really excited about it. Dr. Ivanov is doing wonderful. We're going to be using Zymot for IUIs, where the Zymot is a device to separate sperm like a swim up. It's an add-on that you might look at for either IUI or IVF that may help kind of separate away the fragmented DNA sperm, the less inflamed sperm, to get the better sperm, by the way. Anna Griffin, how you doing? HSG on Tuesday, 2 fails. If a blocked tube is found, or hydrosalpinx, get rid of it or clip it. Most likely get rid of it, by the way. April, Dawn, who will be suspects I have endo and wants to do a lap. Receive my meds from you guys. See my staff for IVF. Should I do the retrieval, lap, then transfer, or lap, then IVF? Either one is fine. I think laparoscopy, hysteroscopy finds a lot of silent endometriosis. Now, if you're infertile, you know that's not silent. So endometriosis causes infertility, causes repetitive losses, and may also cause later term pregnancy complications. So get a laparoscopy, hysteroscopy to excise or vaporize, depending on the location and the depth, the size of the lesions, or go towards the medical treatment for endo, which is Lupron or Lissa plus letrozole for at least 2 to 3 months. And don't forget, look at the antimicrobial protocol and the antihistamine protocol. Uterine lining scratch before transfer. Let's see, make sure, Mimi Poppins. So it's usually sometime a week, within the week prior to your next stimulation cycle, or before you start your cycle for a frozen transfer. If you have regular cycles, it's in the luteal phase or the post-ovulatory phase. An endometrial scratch, quite often we may add a hysteroscopy, D&C, along with the scratch. Don't forget the ERP from Cooper, the ERA from iGenomics, and the Receptiva DX, which may help some of you who are looking for more definitive diagnosis or a diagnosis of possible endometriosis before you do the laparoscopy. And the Alice, and I can't remember the other one. My brain is a little farty right now, looking for other inflammatory markers that are important. And I think when you look at doing blood testing for NK, ANA, lupus, ACA, you look at antithyroid antibodies, you look at CD levels, TH1, TH2 levels. There are a lot of things, MTHFR, that you could look at that might say, hey, I have inflammation. Now, we already know you have inflammation because you're infertile, you have a problem. So we're going to treat you anyway. But some of those that really want to do something, we're good to do that. Let's see. Raven Love Joy. Yes, our Monroe office with Dr. Verdialis does monitoring in the Atlanta area, but we'll work with any of your OBGYNs down there or fertility clinics, because we work with many of them. They're really great. A lot of great fertility doctors around the globe that can be very helpful for you. Trisha Sanders, how you doing? PCOS with infertility diagnosis, 2 failed IUIs with letrozole ovulated 3 both times. What should I do next? HSG fine, sperm within normal limits. Well, Kiltz's keto lifestyle, low-dose naltrexone, CBD oil, the molecular fertility supplements, I think are really good. And the inositol can be really good. Again, fasting is really, really a big and important thing to me. Don't forget laparoscopy, hysteroscopy with ovarian acupuncture or ovarian drilling might find something that is helpful for that journey. And never, ever give up. And if IUI is not working, but if after 3 fail, do laparoscopy, hysteroscopy, or medical treatment. But I think the laparoscopy, hysteroscopy with ovarian drilling is very helpful. And don't forget the immune protocol as an add-on, even if you're doing intercourse, IUI, and IVF. There's the Humira and IVIG in the level 4. There's Neupogen, Plaquenil, or Prograf with higher dose Lovenox, higher dose prednisone. Don't forget PRP and HCG washes also. April, Dawn, how you doing? IVF for the first time. Sure how. And we have our look at our Seeing Life Fertility website, drkiltz.com. Don't forget to check out Maria and Craig Emmerich on keto. Ken Berry has a YouTube channel. He and Nisha are doing a lot of stuff talking about keto and carnivore. I mostly practice carnivore, but whether you're a vegan, a vegetarian, a Mediterranean, a pescatarian, or a carnivarian, there's a lifestyle that will improve your health and wellness and reduce inflammation for sure. Southern Girl, 39, laparoscopy done, found tiny endo, tubes look great, third failed IUI. And that's where, again, laparoscopy you've already done. This is where looking at keto lifestyle, Kiltz is carnivore, the baby's diet, bacon, eggs, butter, beef, ice cream, and salt, one meal at night. No snacking through the days. I know it seems a little radical, but the moment I did it, I've never felt better. Now that I'm 65 and my bowel bleeding gone, arthritis, psoriasis, kidney stones, migraines, IBS gone, it's an amazing game changer for sure. Let's see. Yes, keto. Best diet for health and wellness and fertility. And when you're pregnant, stay as close to Kiltz's keto as you can. Vegetables, fruit, fiber, seeds, and nuts are never required in a human diet. We are required to get fat and proteins, but no carbs ever. And what you don't know is that plants are the predators and we're the prey. They're just simply out there trying to eat something, and we become its fertilizer. Zymot was told it wouldn't be as helpful for us because we're using donor sperm. Even Zymot may be helpful for donor sperm, by the way. Our team is learning about this. It's all new. And don't forget, if your TSH is not less than 2.5, put a flag up and say, hey, I'm running high, up your dose, stop your cycle, do something. But we really want to make sure. Now, if you check a T3, T4, free and bound, that and they're normal, sometimes we're seeing these elevated TSHs. So we really want to look at all of this very carefully. Stop. Take a moment. And don't forget, lots of prayer, meditation, visualization, and persistence, and have faith. The greatest thing we all start with is faith. And faith is the key to all of our lives. You have to have a positive attitude for sure. Let's see. Erica Murphy, PCO, 2 canceled IVF cycles after slow follicular growth, was taking Lupron, Gonalef, Menopur in thighs. Doctors recommending antagonist IVF cycle, letrozole, ganirelix. I hate that thigh stuff on that. But look at keto, laparoscopy, hysteroscopy for sure. Some PCOSs have to go to a higher dose to start because they have very resistant ovaries in the 300 to 400 range. And no HCG supplement and maybe no Menopur, just straight gonal might be good, but at least 400 for maybe 4 days and then drop it down. I like the antagonist, ganirelix or cetrotide. But some people will do a Lupron suppression or do the birth control pill. I like estrase, prometrium, human growth hormone. And don't forget the molecular fertility supplements for both men and women, and the ovarian bloom for those with any diminished ovarian reserve, and DHEA, anywhere between 50 and 100 milligrams per day can be helpful. Iodine deficiency with thyroid test. I've heard iodine deficiency can cause, well, so many people are iodine deficient for sure. But again, there's the proper diet is really helpful. Look at Judy's Cho book on carnivore cure. It's going to be a link. Look at Maria Emmerich's stuff, really fascinating stuff for all of this. But make sure you're getting some iodinated salt. But the majority of our problems stem from leaching. The plants are leaching out of us the minerals and vitamins as they leach them out of the soil. We're just another piece of dirt. And then they want to make us dirt so they can grow out of us. That's the craziness. Sarah Vital, Let's see, La Bella's Della Vida. Yes, Cerevital is another form of human growth. It's a over-the-counter. Yes, it may be worth doing. Hi, Sylvia. Is molecular fertility good for women that will undergo a donor transfer? I think it is for sure, and certainly keto is for sure. And I know I may have missed calling you, Sylvia, so I apologize. If I need to reach out to you this week, you know how to get a hold of me, and I'll be glad to do that. Lisa Ann, PCOS patient, age 40, no pregnancies, first IVF cycle. Be next. Should I feel concerned with endometrial polyps recurring? Certainly, PCOS, polycystic ovarian syndrome, is a metabolic disorder. It's pre-diabetes. It's a lot of inflammation. There's a lot of recurrence of things like ovarian cysts, endometrial polyps, and I think even endometriosis and uterine fibroids can be found. So by changing your diet, your lifestyle, it'll help. This is where, again, the inositol, low-dose metformin et al. And if you're doing a laparoscopy, we'll often do a diagnostic scope with a frozen transfer. But in cases where you're just looking inside, it's completely normal, you still could potentially do a transfer. Don't forget PRP, HCG, and Neupogen washes. They can all help with implantation because they reduce inflammation. Today, 45,789. Fibroid removed. Let's see. It can help, by the way. We look forward to. We're working on getting some earlier consultations for everyone. In the meantime, when your consults are a month, 2 or 3 out, we apologize. You're learning a lot from all of this. Take our family building guide, look at it carefully, talk to your OBGYNs to get, let's say, hey, can I do a laparoscopy, hysteroscopy? Would you do one? Dr. Kiltz and his team at CMI Fertility recommend keto, fasting, and laparoscopy, hysteroscopy. And don't forget our supplements, by the way. Too much progesterone when pregnant. I guess you could take too much of anything, but probably not. But, in our general supplements, I don't think it's a big issue. Let's see. Benoble Jack. I've got thyroid nodule, which is caused by a plant-based diet, by the way. FSH-free T3, T4 levels were normal. All IUIs. So, if nodule could still be causing me not to conceive, my endocrinologist is not recommending medication. Well, the nodule, yes, you sometimes can take some thyroid supplements that may be helpful. The problem is there are some antigenic particles in plants, lectins, oxalate, phytates, glutens. There are glycoproteins and glycolipoproteins that cause these nodules, cysts, fibroids, lipomas everywhere in our body. They're the factor. So if you have these nodules, you have inflammation in your body. That's the culprit and the problem, unfortunately. Some of my embryos were multinucleated, but they're still viable. We didn't get them tested. What's your opinion on multinucleated embryos? I save all embryos. We're not that good at looking at a microscopic thing and knowing what it is. Either you're 1PN or multinucleated, all embryos should be saved, should be cultured, should be frozen or transferred as you desire. If you want to test them and they get to blast, you can do that. In my opinion, we're not very good at defining what an embryo is capable of, by the way. Umbilical cord blood stem cells for reducing inflammation causing infertility. Terminal, yes, I think that's good. I haven't had any experience personally, but stem cells, whether you're doing intrauterine, intraovarian, or intraperitoneal, may be helpful. Remember, if you do a hysterosalpingogram with oil contrast, it reduces inflammation in the intra-abdominal space. That's why I think even for those people that have a diagnostic laparoscopy and hysteroscopy and find nothing, many of them will still conceive and get pregnant because you flushed out a lot of the mucus. It's kind of like the saline stuff we use to flush out our sinuses can be very helpful. What caused progesterone to fall after transfer? Let's see. Well, basically, there's a lot of fluctuation. As long as it's above 10, I'm happy in general. We're looking for above 20. There's a lot of fluctuation, but when your estrogen level will drop after ovulation. Progesterone levels will rise. After implantation, we often will see it drop a little bit. So it's not unusual. We're always chasing it. If it's a natural cycle and it drops to less than 10, that's not good. But if it's a medicated cycle, we like to see it in the 20 range, but above 10 is good. FET next cycle, ordered lipids and HCG wash. Should I do any other things to improve implantation? Well, look at the Family Building Guide, Implantation Enhancement. This is where Neupogen, Lovenox, Plaquenil, Prednisone, lipids, even IVIG can be helpful. And of course, Kiltz's keto and the supplements, really good to do that on it. Lupus anticoagulant, ANA, ACA lupus. It's just another marker of inflammation, which is an autoimmune disease. No, it's not an autoimmune disease, actually. There's no such thing as an autoimmune disease. They're immunologic reactions from our body to foreign particles that get to us via our skin. We breathe them, we drink them, we eat them. One way or another, they get into us. So the ANA, ACA, and lupus, this is where Lovenox, aspirin, and prednisone or dexamethasone come in. And of course, guess what? Am I going to say Kiltz's keto lifestyle is king? Craziness. Let's see. Ked XOX. How many rounds of Clomid do you recommend before moving on to other treatments? I don't recommend more than 3 before you look towards either laparoscopy, hysteroscopy, HSG, semen analysis, complete testing if you haven't done it. But I like letrozole trigger IUI with intercourse. Look at the immune protocols, look at immune testing, look at all this testing, which may be giving you a little bit, hey, I have inflammation. I should really do a Kiltz's keto lifestyle. I should do an immune protocol. And I should get off the treadmill, slow it down, go for a walk in nature. Anna Bartolini, how are you? First cycle mini IVF got canceled because no growth of follicles to 10 millimeters. So, well, this is where I think letrozole low-dose injectables or a mini comes in. But again, maybe even raise the dose a little bit or stop and give it a week and restart. But these are the tough parts, depending on your AMH and all of this. Some people won't respond to that to the low dose. Go to the 400 to 600 range. You might see it under rare circumstances. We've done 900 also. Atlanta office doing transfers and retrievals. I'm hoping that those both offices, Sarasota and Atlanta, will be later in the year. I'm working with Dr. Verdialis, Dr. Condrip down in Sarasota. Taryn, my midwife said I was fine. Let's see, where did I lost that? It goes so fast here. Was 1.98. I went to CNY 3 years ago and was put on meds for thyroid, CNY, but midwife said I'm fine. So again, there's some subtle low doses when you're finding ANA, when you're finding antithyroid antibodies or nodules. A little low dose thyroid hormone may be helpful for that, by the way. Brenda, how are you? Brenda Lee, 43 with endo, MTHFR, Lapin 19, fresh transfer failure, awaiting beta from FET. If failure, what would you suggest? Well, go down the list: keto, immune protocol, mini protocol, do a fresh or a frozen transfer. Don't forget the laparoscopy, hysteroscopy if you haven't done it already, and always look towards donor eggs as an option. Let's see, CDOL, 60, 6'11", 65, myomectomy. They should have seen endometriosis. Would you still recommend a hysteroscopy? I think if they haven't done a hysteroscopy, it's a good idea. And a little bit of a clean out, a light DNC at best to kind of clean things out can be really helpful, by the way. Starting stims today for an IVF immune protocol, normally, let's see, starting stims today, CD for an IVF immune through protocol. Go to the Christine Kruger, go to the immune 3 protocol. Tell the nurses immune 3 per Dr. Kiltz. Normally, when should we expect to go to Colorado for travel? Usually about day 12 is the retrieval of stim. And remind my team, level 3 for most IVF or IUI. And don't forget laparoscopy, hysteroscopy if you haven't had one. And fresh Fresh works a lot, by the way. And just ask, can I have a fresh? And if your TSH is greater than 2.5, don't do a transfer. You might do a retrieval, freeze them, or cancel a frozen transfer until we could say, hey, we've looked at a T3, T4, and it sometimes we'll get a reaction of the TSH post-transfer with the high estrogen levels that it goes up. But as long as your T3, T4 are good, you're good to go. The life of two women, two moms. Can high mosaic and normal embryo be transferred together? Yes. Mosaic embryos make plenty of normal babies. It doesn't matter if it's a high level or medium level or low level, and plenty of aneuploid embryos, those are abnormal embryos, can make beautiful babies. Charge for an IUI. Look online. I think on our website, we have some pricing on there. Will is really keeping that up and doing a lot with that. Christy Baldwin, how you doing? Having a hysteroscopy, laparoscopy, DNC, and selected tubal cath, possible removal of the tube if it's a bad tube, and a biopsy was added on. What is the biopsy? The biopsy is just kind of identifying inflammation in the uterine lining. Often it might say, hey, treat with a month of antibiotics versus a few days. So that's why it can be very helpful. Just want to say a pleasure. Thank you, by the way. Left Syracuse feeling hopeful. Elizabeth, hope leads all. Faith over hope, and hope over hopelessness, for sure. Always be hopeful and have faith every day. Whatever your religious or spiritual belief is, whether it's atheist or agnostic or theist, doesn't matter. Find hope, be faithful within the mind that all things happen as God has intended. And remember, God is within all of us. So guess what? That makes us God. I know it's all crazy, by the way. And if you haven't checked out my book, The Fertile Secret, check it out. Might be kind of fun and helpful for you. 4cc embryos. What do you recommend for 4cc embryos? Well, judge not lest ye be judged. I don't believe this grading is very accurate. An embryo in a uterus is the only way to know if it's going to work and make a baby. If you're trying to judge it in the lab, in the freezer, not very good. So how soon after laparoscopy can I do a IVF cycle? A week, 2 or 3 afterwards. You don't have to wait. Remind my team members. Dr. Kiltz said on the live, I don't have to wait after a laparoscopy. If you had a myomectomy or significant surgery, you might wait a week or 2 to heal up a little bit, but certainly before you could do a retrieval. Transfer often needs to wait a little bit longer. Priming is best for DOR. Let's see, Britton Scott. So I do a lot of human growth hormone, omnitrope, serovital, or somaderm, which is along with estrase prometrium for at least 2 to 4 weeks, if not a little bit longer. Kiltz's keto lifestyle, low-dose naltrexone, and DHEA, 25 to 75 up to 100 milligrams a day, I think could be very helpful. And keto. And then go right into a stimulation, by the way. Don't stop. Don't wait for a period. It's baseline ultrasound on the estrase, prometrium, and omnitrope, which I like to do 3 to 6 a day in priming. And I think it can be very helpful. Never, ever, 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 ever give up. Remember, there's always donor eggs, donor sperm, donor embryos, gestational carrier, adoption, and find the joy and happiness exactly where you are this day as every day. How many cycles can you do with human growth hormone? Andrea, you could keep going every month, but sometimes I'll find some people don't do as well with the human growth hormone. So I generally will say, you know what, just back off on it and don't do it. How's everyone doing? You guys doing okay? Another beautiful day. Every day we're doing our very, 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 very best in life, right? Don't give up. That's the trick and the most important thing for sure. Transferring 2 embryos, a day 6 blast and a day 5 blast. Yes, Elena, 689.34. Absolutely. You could even do a day 3 and then do a day 5. Technically, you can. So I'm not against those things. It can be done. Birth control to kill my cyst. Lindsay Morrow. I'm not a big fan of the birth control pills. Sometimes just drain the cyst and get you going. But waiting is good. Estrase, prometrium, and the birth control pill can help a little bit. But these cysts are very common because there's a lot of inflammation in the ovary, which is going to damage the ovary for sure. Pregnancy tests at home have been consistent line, but super faint. Is that most likely a chemical? The life of two moms. Yes, that could be a biochemical, could be a false positive. Don't know for sure. So we want to make sure you're getting that checked. Coffee causes infertility and miscarriage. Kiltz is off coffee for now, like 4 months, which is crazy. I think too much of tea, too much coffee, and certainly alcohol, marijuana, or any other drugs are deadly for us. So get rid of them. Water, a little bit of tea, a little bit of coffee. I don't think it's much, but it may be in some cases the plant phytochemicals and antigens that we drink in coffee are not good. Let's see. Kamini Love had a lap done years ago and was told my tubes are blocked. Should I still do HSG before starting IVF? I'm 35. I'd probably repeat it if depending. Sometimes those tests aren't very accurate, but you want to make sure there's no hydrosalpinx in order to decide whether or not you should remove them. I do. It's always good sometimes to recheck some of these. I don't think cysts affect implantation. And if you have a cyst, I don't think that changes whether or not you can still do your stimulation. Even with the dominant follicle, I'll still do lots of stimulations. I think that's okay for sure. Tuesday retrieval with Dr. Mag doing PGYM. How does FET work for starting? Basically, you make your embryos, you freeze them after you biopsy them. The next cycle, you'll either do a natural cycle or a medicated cycle or a letrozole trigger cycle, but you want to make sure you have your PG testing back first. So you sometimes are going to wait a month before you're going to do that. But it's about you're doing a transfer about day 21 of a cycle ish. There's a lot of variability. Just want to hear if a zero ovarian egg reserve means no chance for biological child. If you're in menopause, there are some cases where you can revert from menopause back into fertility. So no one can ever say zero in our business, and we shouldn't say it. All things are possible. Acupuncture, massage, meditation, prayer, visualization, and never give up, by the way. How does cyst affect fertility? I don't think cysts affect fertility directly, but the inflammation that may cause a cyst may be causing your fertility issues. That's kind of where I'm at. Unless you have an inflammatory cyst, an abscess, an endometrioma, and sometimes even dermoids can be inflammatory. Letrozole cycle versus a normal cycle, Carissa. Basically, you take letrozole for 5 days, you do a trigger shot with some monitoring, ultrasound and blood work. In a natural cycle, you just do the same thing with ultrasound and blood work and a trigger shot, but you just didn't take the letrozole or Clomid or some other stimulatory medication. So it's very similar in the process, but we do a lot of letrozole. It kind of improves the odds of getting a follicle a little bit more than just doing a natural cycle. Me and my husband both have MTHFR gene and was told it caused infertility. Not necessarily. There are a lot of men and women that carry the MTHFR genes that have fertility and have no issues. My theory is that it may be this gene increases your predisposition to infertility, blood clots, and other diseases due to the improper dietary environment we put in our bodies or other things that get in our bodies. That just means we're predisposed to this. This is where aspirin, Lovenox, Plaquenil, prednisone, and of course, guess what? Am I going to say Kiltz's keto lifestyle? That's it. Letrozole cycle for every FET. Yes. And 4 boys in IVF who gave only boy embryos was we are going to be donation to have a girl. Sometimes you need to change the sperm up, but even though you might have 4 boys, you can still find a girl embryo amidst that mostly boy sperm. Let's see. Journey to babies. Having a lap done in Syracuse, 2 years since my last lap incision. Do you primarily do excision, endometriosis? We do both. Depends on the location. Primarily, we excise it. If you find a very superficial area where you can just vaporize and eliminate the perineum and you can see it's gone, that's okay. But excision is what we recommend as the first and primary focus. But interesting enough, the medical treatment may be as good as the surgical treatment. So how important is excision versus vaporization? I don't know that I absolutely can answer that question for you, because we've done plenty of excision, plenty of vaporization, depending on location, size, and depth, by the way. Recommendations for anxiety, depression meds during this process. Talk to your doctor who's prescribing them. Look towards meditation, acupuncture, massage, herbal teas. Look towards keto. I think carnivore is a game changer, but if you need them, you need them, and we support you whatever you need during the process. Make sure they're class A, B, or C when it comes to pregnancy classes. Jocelyn, why do letrozole? Why do estrogen? Why do natural? Why do medicated? These are all just options along the journey. If one way doesn't work, we all have our favorite ways to doing things. Some people don't want any drugs, or they just want a little bit. But our standard is going to be a medicated with estrogen and then progesterone with an immune protocol for a frozen. But we do a lot of natural and letrozole with the trigger shot. We do occasional gonadotropin stimulation for a frozen, where you take the gonadotropins, just like you're going to do an IUI or an IVF cycle, with or without a retrieval or IUI. And then we do the transfer. It may also be valuable, by the way, to have intercourse or do an IUI before a frozen transfer or even a fresh transfer, which may help reduce inflammation in the pelvis and increase implantation. Dr. Chang, Dr. D'Souza, Chris Ziegler, thank you for our Buffalo team, and a shout out to our Rochester team. Thank you for all the amazing stuff that you guys are doing also. How many rounds of IVF is normal for success? Kayla, there's no answer to that one. However many it takes for you to get the success you desire. 1, 5, even 10 to 15 we've done before success. So it's an odds game. Don't give up. Fertile Hope Yoga with Aaron. Check it out. I had my last IUI on July 2nd, but recently started having really bad cramps and spotting. Only cycle day 20. About to start my period early. This is the part where inflammation, post-ovulatory cyst can be bothersome. It should be checked. If you're having a lot of pain and discomfort, don't ignore it. Get it checked out. Mild infections are not common, but can happen also. Husband who is hesitant about donor eggs, 47 and 50, feels it's unnatural. Well, driving a car is unnatural. The diets we eat are unnatural. The devices we use here are unnatural. The majority of stuff we do as modern human beings is completely unnatural. If you want to have a baby and it's not working naturally, that's where donor eggs, donor sperm, donor embryos, and adoption come in. So these are just options for the journey, but our sperm and eggs came from all of us. We're sharing the same sperm DNA and egg DNA and embryo DNA. It's thrown out to the universe, and we're sharing all this DNA. Our epigenetics are sort of turned on and off based on our thinking and our environment. So focus on the joy and journey and the prize that you desire, and don't ever give up, by the way. Infection from uterine lining scratch. You could get an infection from any procedure that we do, whether it's IUI or IVF or a scratch, hysteroscopy, or surgery. So you get an infection from having sex. So infections and inflammation can happen in any treatment we do. So if you're getting some pain and discomfort and you're not sure, that's where antibiotics, antifungal, antiviral, and the antimicrobial protocol, along with the antihistamine protocol, the Claritin, Pepsid, and Benadryl, and don't forget the anti-endo treatment. You guys are all doing good, I'm sure. Let's see. Becky, what role does testosterone play in fertility? Low AMH and AFC. So this is where DHEA, a little bit testosterone may help in boosting your fertility, may help your quality. We do a lot of DHEA. a lot of estrase, a lot of human growth, and a lot of keto. I don't do as much testosterone supplement, but because the DHEA essentially functions as that. Intercourse the day before your transfer day. Yes, I think sex beforehand could be helpful. Orgasms can be helpful. Inseminations may be helpful. This is where the uterine PRP, Neupogen, and HCG washes may also be helpful. Let's see. Bird Bash, 44 two-egg retrievals, 10 mature, another with 12 mature. Get from 20 matures have euploid embryos. Do you think I can get? Let me get back to that. Sorry about that. 12 mature. How many good embryos do you think I could get that? No one knows that answer for sure, but you need one good embryo to make one good baby. So always focus on, I'm going to make lots of great embryos and I'm going to get a great baby, or 2 or 3, whatever you desire. Don't give that up. There's no way to say exactly how many you're going to get from that, unfortunately. I'd be lying and guesstimating, which we do a lot. But if you're making a fair number of eggs, you have a greater chance of making good embryos. But don't forget, it takes a good egg and a good sperm to make a good embryo, and obviously a baby. Let's see. How do you know which option is best? Was given the option to a normal medicated FET or letrozole. Look at Carissa, unfortunately, you're going to talk to different practitioners. Our standard is estrogen and progesterone with an immune 3. I do a lot of natural cycles, but if you have a lot of, if we also often don't, we don't really understand the causes of infertility in the sense of, is it inflammation? Is estrogen, progesterone good enough? But I find that a lot of natural and letrozole trigger shots are less sort of stressful because you're not taking as many drugs. And I think that makes it a lot nicer for so many people, by the way. Transfer, can I start keto to be able to see the results? How long before transfer? To the day of your transfer, start Kiltz's keto. It's a game changer. Stay keto when you're pregnant. Keto lifestyle is the healthiest thing you can do. We've been domesticated and duped and lied to. Unfortunately, you and I have been eating a culturally correct diet for thousands of years, and now we're being told what we can and can't eat. Well, if you have a problem, it's your diet. If you don't have a problem, it may still be your diet, which you may suffer one day, but this stuff is really crazy. Recommend usually for a flare Lupron protocol. I do 10 units. You can go to the 5 for a microdose or lower. 0.25. It's a little harder to drop on the syringe, but I like the 10 units of Lupron to start with your cycle and stay on it until you start your progesterone or your trigger shot. We don't do a lot of Lupron flares anymore. What dosage? Let's see. Wendy, quick, 2 transfers failed. Lap 820, 20, endo 3. Should I do another lap? Yes. Or do the anti-endo medical therapy. That might be pretty helpful for you. Ashwalt, can you ovulate while taking Provera, trying to bring on a period to start letrozole, but had ovulation symptoms? You could. I recommend estrase, progesterone, stop it, and then get a baseline ultrasound and blood work. Sometimes you're not going to have a menstrual period, PCOS-like, metabolic-like, but ultrasound and blood work can kind of identify. If you have a thick lining and you have a low estrogen, progesterone, add both estrogen, progesterone for about a week to 10 days, stop them, see what happens. Otherwise, hysteroscopy, DNC, in some cases, or ELISA or Lupron may be helpful, by the way. Husband travels a lot for work. Can he send a frozen sample for the egg retrieval? Yes. We have a specimen container box you can get at home. You could ship it back, and we can freeze it. That may be enough. Go to a local clinic, get it frozen, or fly to one of our centers and get it frozen. Those things can help for sure. What are the reasons that few couples are able to produce babies, only one gender? Is there any cure to address? I don't know the answer why some people have boys and some people have girls. It may be, again, just the sheer number of X or Y sperm, or it may be something about the body's ability to grow a male or a female embryo, or the immune system that may attack a male or a female more likely. But those are all the possibilities. Um, 37 AMH 0.5, grade 3 endo, but no lap does, well, if you haven't had a laparoscopy, I don't know how you know it's a grade 3 endometriosis. I would do the laparoscopy. I would do keto. I would do either Orlissa, Lupron for at least 2 months. Let's see, egg freezing, 2 follicles, 7 follicles, recommendation improving yield. The yield is good. Everyone's trying to get more eggs, more embryos, but it's quality over quantity. Keto, LDN, fasting is lasting, and it's a high fat is keto, by the way. It's not a low carb, it's high fat, and it's not a high protein diet. But look at our family building guide. You get a lot of, I can find it. Oh, let's see, right over here. A lot of stuff on the family building guide you might find very helpful. It's on Amazon, or go to our website. A lot of great stuff to help in that. Thyroid peroxidase was 14, TSH normal. PCB doesn't want to treat me. This is where it might be for low dose or Armour thyroid, just 25 micrograms a day. Change your diet. Add the low dose naltrexone to reduce inflammation in your body. ER in Buffalo, acupuncture in Rochester, worth doing a session the day before. It's always good to do a session the day of or the day before and the day after for sure. Meditation, yoga, acupuncture, and massage. Had lap for diagnosis, no treatment. Sween. If you're doing a lap, you see it, remove it. If they didn't remove it, do either the medical or go back and remove it, either vaporization or excision. I think they both work very, very well. You got to get it all, by the way. But my theory is that endo is a bowel disorder. It's IBS. It's Crohn's. It's all these diseases of the bowel due to fiber, fruits, seeds, vegetables, and a low-fat diet. Remember, fat is the soap of our bodies. We should be eating more fat. Just cause more scar tissue built up, which could hurt fertility. You're getting the benefits. It's like going to the market in a car. You could get injured or die in a car going to the market, but you go. So the benefits outweigh the risk, and that's how I look at it, Jamie. The benefits of laparoscopy, hysteroscopy outweigh the risk. But if you don't want to do it, then that's where you go to the anti-endo, antimicrobial, and the antihistamine protocol. And don't forget, Kiltz's keto lifestyle is a game changer. Joy, Jamie, Sween, Kimberly, LDN, but I have an extreme pain from endometriosis. Would taking it after my period, I'd say low-dose naltrexone helps a lot of people with pain disorders, with inflammation, and infertility. We've been using it for over 10 years now. Really helpful. Usually the dose of LDN, usually 3 to 4.5. Some people take a little bit higher, but I like the 3 to 4.5 dose. Highest dose of LDN should we take? 4.5 in general. There may be some others that are using higher doses, but I find that works really nice. Cocos, tell everyone, when acupuncturist has been a game changer for my periods and thinning my lining. Highly recommend it. Anyone in Brevard County, Florida, I know someone. So Mimi Poppins, yes, let's get more acupuncturists out there for fertility, health and wellness, pain, period issues, and PCOS and infertility. Acupuncture, massage, meditation, herbs, and don't forget yoga, and don't forget visualize what you want as if it already is, and it shall be that or better. Never, ever, ever, ever lose hope. Have faith. Fearless is the way. Let's see. All right. Let's see. Morning. T. Shal Davis. How you doing? Vicky Cormer, natural cycle versus IVF for family balancing. Well, you could do a natural cycle. You're going to get less follicles, less eggs for IVF PGS. So typically we're going to do some medication for IVF, but our way we do family balancing is we take an embryo, we biopsy, identify if it's a boy or a girl. That's the way we do it. Let's see. Omnitrope should I be on before egg retrieval? How often? At 44. Usually I use 6 to 8 units is usually enough for that cycle. Let's see. Netanomi. Hello. What are your thoughts on IVF with adenomyosis? So adenomyosis is inflammation of the uterus due to phytates, oxalates, lectins, which are plant-based particles that basically get into our body, micronize, damage our uterus, ovaries, tubes, testicles, gallbladder, liver, spleen, brain, skin, eyes, everything. So I think that if you look at Kiltz's keto lifestyle, 1 meal a day at night, and low dose naltrexone, maybe some CBD oil, and Lupron or Orlissa for at least 3 months. You might even go to 6 months. That may be helpful in all of this. Success rate of being able to have natural pregnancy after removing endometriosis. Jamie Di Stefano, is there a success rate of being able to have a natural pregnancy? Yes. But problem is that you're either going to be a 0 or 100% in any one cycle. All you have to know is that what you're doing is going to help you get to where you want to go. And you have to participate in the process. You have to have sex or do IUIs or do IVF if that's what you need in order to increase your fertility and chance for success. Brianna, benefit of metformin doing FET if you do not have signs of PCOS. Well, polycystic ovarian syndrome is irregular cycles and infertility, technically, but you may not be infertile, but that's how we look at it in this business, or anovulation. 50% are overweight, 50% are skinny. Many people have excess hair, many don't, acne, lots of things, but think of it as a metabolic disorder or pre-diabetes. That's why I use either inositol, keto for everyone, a little bit of metformin, that I believe is the leading cause of disease, no matter if you're a man or a woman. We got to we're trying to pigeonhole everything and give it a nice fine diagnosis that it fits into something. But think of it all as a circle. It's always moving. And the cause of disease is mostly inflammation due to fermentation of the carbs in the belly, which make bloating, heat, gas, alcohol, aldehydes, hemorrhoids, hernias, and damage everything and cause miscarriages, by the way. Alternate day, let's see. Boss Mama, let's see. Alternate day fasting, 42 hours, eat a large meal, then repeat, and it made my cycles longer than shorter, was messing them up, was OMAD, do the same. Look at it. You may be doing it that way, but likely you're putting some plant material in your body or an organism that ate some particle that was deadly and damaging for our bodies. So whether you're eating 1 meal a day or doing this 48, it's what gets into our body that is the damaging phytochemicals, the plant antigens, the high glucose levels. And when you're eating a lot of fiber, it takes days to digest. And so I might only eat 1 meal a day or less, but as long as my belly is carrying around the digesting food and it hasn't been cleared out yet, you're going to have a ton of disease, unfortunately. That's the craziness to the story. Think of your belly as a bucket. That's a bag of fermenting fruits, fiber, vegetables, seeds, and nuts that take days, if not weeks, to digest and cause a tremendous amount of damage. That's why I recommend a high-fat, low to no carb, and a low to medium protein diet. But again, forget all this trying to measure it out. I don't measure any of it. Personally, I eat a ribeye steak every day. Snake River Farms, they're dry-aged, amazing Wagyu ribeye, which lasts me about 3 days. It's amazing. I add the fat, salt, a fragua, bingo, game changer. But the bacon, eggs, butter, beef, ice cream, and salt. But again, as a vegan or vegetarian, look at our family building guide, look at Kiltz's lifestyle and the Fertile Feast. You'll find some really good stuff there, by the way. Start stimming stems for our first retrieval. CMY short, is it possible to decide on fresh transfer after we find out how many embryos? Yes, I do a lot of fresh transfers. I think as long as your progesterone is in the less than 2.5 at trigger, some people say 2, but it's your embryos, your right to decide. We're here to support you 100%. That's the key. WTF call tomorrow following failed transfer. I believe I was on low dose protocol, but added baby aspirin because I have MTHFR. Look at the family building guide, the immune protocol 3 and 4, up the prednisone, up the Plaquenil, up the Lovenox, and Kiltz's keto lifestyle is king. One meal, that's the key. Cook the carbs well or eliminate them altogether. Add the fat. That's the key. All right. It's really a pleasure. I'm in the office Monday, Tuesday, some on Wednesday. I'm taking calls on Thursday, Friday. I'm going down to Sarasota to work and just review the new office coming up, do some calls. Dr. Banerjee will be in Syracuse with Dr. Condra and Dr. Lutheringer this week. Dr. Corley's working on calls through Monday. We'll be back in the office Thursday, Friday, Saturday. And really, really grateful to everyone joining in. Thanks for your questions. I wish I could get to every single one of them, but if you go to our website, if you look at the lives, there's a lot of answers out there. The family building guide, most important, faith first, always, and fertile fatty foods will build your fertility. Look at Kiltz's keto lifestyle. God bless to everyone. Thanks for joining me. I'll see you guys next week, if not sooner. And I look forward to talking with you guys. And again, amazing team at CMI Fertility. We're always learning. We need your critique and ideas and what we can also do better on a regular basis. God bless to everyone.